Great to be here in Dallas-Fort Worth. This is one of the largest metropolitan service areas, actually the fourth largest in the country. Over 8 million people live in this area, and well more than 2 here in Tarrant County, which is Fort Worth. And when we were in Columbus, Ohio for the Live in a Location with the Franklin County Crisis Care Center, we were joined by Eric Hipple, former Detroit Lions quarterback, and also an author of Real Men Do Cry, about his own suicide attempt, about his recovery, about the death of his son Jeff. And we're thrilled to be joined here in our visit to Dallas-Fort Worth with Tim Walton. Tim.
Hey, how you doing?
Welcome.
Oh man, good to see you. Oh man.
Thanks for making this flight.
Man, wouldn't be any other place I wouldn't be with here.
Tim, we're going to let our cameraman come around this way, and you and I are going to stroll through this green space a little bit.
Okay.
Tim, you got in. Thanks for making this flight. Eric introduced us. You and I met in Phoenix when you were there for a wedding, and
Yeah,
you flew
absolutely.
in late last night.
Exactly. We got in actually about 1 a.m. in the morning, so not much sleep here, but the weather's not that different either.
The weather's not that different. So tell everyone a little bit about yourself. Both you and Byron Williams was hoping to join us. We don't know if Byron's gonna make it, but both of you worked with the Players Association, with the alumni.
Yes.
Tell us about your role, Tim.
So my role is I've been the president for the last 10 years for the Detroit chapter. I'm currently the vice president. I'm also currently on the NFL Players Association Board of Directors. Yeah. Byron was also a president for the Dallas chapter for the NFL Players Association, so he's supposed to be joining us. Yeah. I can't believe I beat him. He's on the way. I beat him from Michigan. How about that? But currently I am also, along with Eric Hipple, at our Peer Pride, and we, the Peer Pride is a lot similar to what you guys are doing. We're involved in mental health, and which is so important nowadays when you look and see what's happening in the community with athletes all over. So even just recently with the young man that lost his life. So it is Marshawn Lee. Yes. So it is very. It's something that is it's hands-on, and the Detroit alumni chapter, our Peer Pride, I would call captains, and what we do is we just kind of reach out to all those who played for Detroit, just to make sure that they're okay. When you leave this game in particular, talking about athletes, it's tough. It is. It's like you have to learn how to live life all over again, and mental health is very, very big, and we take it serious, and we make sure that we are very impactful. So I'm happy to be here.
So, Tim, men in sports like pro sports like the NFL expected to go through pain, but not necessarily trained for how to go through these challenges. What's the cost of that?
The cost is, I don't think we prepare ourselves. The coaches can't prepare you for, we can prepare you for physical elements, but when it comes to mental elements, people don't realize that most of us have been playing this game since we were 10 years old, and it's all we know. It's our life, right? And so the crowd, the enthusiastic, we feed off that. And once that's gone, I'm talking specifically with athletes. Once that's gone, it's hard to deal with, and so.
There's a big capital P purpose. There's a lot of camaraderie and teamwork, and all of that is the essence of who we are as humans. Absolutely. And then to what degree does that get sort of pulled away as you move forward?
Sometimes immediately, because there's things that happen, especially in athletes. You either get cut, you become injured, or your time's up. You just old age, and all those things are key factors that now you have to deal with the real life situation. And sometimes we don't understand what that real life looks like on the outside until we actually start living it. And so some of these athletes, I think a lot of this is also in the military. I think they go through very similar police. They go through firemen go through it's that team, that camaraderie. When you're together, we feed off each other, we encourage each other, and once that's gone, sometimes you don't you have to be that person A lot of us have kids. A lot of us are married. We're in the church. So once that's gone and taken away, who do you have?
Right. So Tim, we're in the green space outside this facility. Let's start walking toward the front door. We're going to start a Crisis Jam live here at 12 noon Eastern Time, 11 here in...
Exactly right, yeah. I just got here early because I wasn't for sure about the Central Time.
So we talk about that reaching out. What does it mean to have high-profile athletes like the Cowboys, Dak Prescott and Solomon Thomas, talk openly, say that these mental health crises, substance use crises, these aren't just things that happen to certain people, they happen to all of us? What does it mean to have those leaders take that kind of position?
I think it's big, and the reason why I say that, it's major, is because we've been taught as athletes, we've been taught not to share our faults, not to share our weaknesses. We've been taught to be strong, even if it hurts, especially when it comes to pain. We've been taught to, don't show your weakness.
Right.
Do not. That's not supposed to be our character. So to have guys like Dak and those guys who are currently playing talk candidly about mental health, it's priceless, because it's at a point now where it's happening. It's in our homes, it's in our schools, it's in our community. So we have to address those things head on. It's like making a tackle.
Right.
You have to address it head on.
Yeah.
So, and I think I commend these guys for being able to be brave and to speak candidly about those things.
Yeah. And for most of those people going through some kind of crisis, what they really need is a 24/7 response, a dedicated response, and yet so often that just doesn't exist at scale. It doesn't exist in the capacity needed in a community, and so we leverage things like the local hospitals and law enforcement. This is a dedicated facility.
This is beautiful.
24/7 available for anyone who's going through a crisis, so their need is met straight away. I wonder just how much difference, as these programs proliferate, that will make in the ease of somebody seeking help if they know that it's not going to feel like punishment.
Right.
It's not going to be delays or caught or... What are your thoughts on that?
I think that I was just enamored by just the facility, this specifically for mental health. And I was talking to some of the staff, and just to have the voluntary and then the non-voluntary, which is both needed. And so just to have that in place, I think is, you guys are doing something phenomenal here, which is another reason why I had to come down and see it for myself.
Yeah.
This is beautiful. This is so much needed. And if you look in the papers today, it's happening all over.
Yeah.
To people that you don't think it's going to happen to.
Well, Tim, let's give a shout out to Eric Hipple, who's probably watching. Of course, Eric brought both Eric Kramer and himself to our Phoenix facility. He then came to Columbus, so he's been such a champion of this work. And again, you've worked closely with Eric.
Well, Eric's my main man, so I got to give Eric a shout out. Eric was one of the key factors of putting together our Pure Pride in Detroit, Michigan. He was the key factor in making this happen, and kudos to the Detroit Lions, because they have embraced it, and we right now have 12 captains strong, Pure Pride captains that embrace this mental health, and we continue to do this work. So Eric, I love you, and you're the reason I'm here, because you could not be here. I love this man too, but Eric, I knew I had to step in for you. I don't look as good as you, but I'm here, brother.
Tim, the heart you guys bring to this work and the leadership you're both bringing, people like Byron, Bart Oates, who's now leading the CIT International training, mental health training program and support for law enforcement, really it makes a difference. So if the front door's got to be safe to do something different, let's go see what that looks like.
Absolutely.
So we're going to walk right up and we're going to meet Zelia here in a moment.
Okay.
And then what I'd encourage you to do, Tim, is watch on your phone on YouTube, live streaming as we go through.
I'm gonna do that. Yeah.
And then I want to connect with you afterward.
Absolutely.
Yeah.
Okay, great.
So our audience, if you're on YouTube, welcome, or if you're on Zoom, we're going to get started here in just a moment. We've got just another minute or so, Tim, before we go over to meet with Zelia and our audience goes live. We could talk about the Cowboys' playoff chances, but that probably doesn't take us a full 2 minutes to do that.
No. I think we already know where that's headed, and I don't want to. Since I'm in your city, I don't want to.
We hold on to hope.
Yeah, I want to make it. Yeah, well, listen. Hope deferred, maketh the heart sick. That's a scripture in the Bible. I think about maybe next year for the Cowboys. I'm right now still worried about my Lions because we still have an opportunity. But I tell you what, just to speak on the Cowboys, they're coming a long way. So,
yeah,
they're coming a long way. But they were America's team. Honestly, I think Detroit's America's team now. I hate to say that.
I was just thinking about it. I started following them when I was about 7 or 8 years old, and that's right when there were players aging out, and they were starting a new group of Ed Too Tall Jones and Randy White.
Yeah, that's right. Yeah.
And Roger Staubach was making a resurgence.
Exactly.
So, here in Dallas, great to be having this discussion. Great to have leaders like Tim and the NFL be behind these efforts, and we'll look forward to more discussions, Tim, as we go forward.
Absolutely. Thank you for having me.
Okay, so again, if you're just joining us, it's episode 247. We're live and on location in Fort Worth, Texas, with the JPS Psychiatric Emergency Center, and this is a state-of-the-art, safe front door that's directly accessible, and we're going to hear all about how it works, the scale and capacity that it brings, and its history of innovation. So let's go and meet Zelia. Tim, thank you so much.
Thank
I'll
you.
take the mic and I'll shake your hand. Thank you, my friend.
Thank you, Tim.
So welcome. Thank you for joining us. I've been talking with Tim Walton, Zelia Bao, Senior Vice President, Director here at JPS, former state commissioner in Alabama. So proud of what we've seen. Wow. Tell us about the JPS Psychiatric Emergency Center.
Well, first off, welcome to Fort Worth, Texas. And we're really proud of our new Psychiatric Emergency Center. We previously were in a space of 12,500 square feet.
Right
and if
there.
you look to this brown building on the 10th floor is where we were located. And in that space, we did see adolescents as well as adults, and we averaged around 19,000 or so visits a year in that very small space.
Right.
And so with our leadership of our hospital, our CEO and our board of managers, they were really wanting to make access to behavioral health and psychiatric emergency care better, and they wanted to have better capacity for safety as well as treating more people. And so this new Psychiatric Emergency Center is the result of that.
Yeah. So you were mentioning yesterday some of the limitations of that space, and even with those, this was a cutting-edge program. So for those of you who are crisis jammers, a lot of you have been tracking this work for years. Some of you have been to places like the Tucson Crisis Receiving Facility, or you've been to programs in Phoenix or elsewhere. Those all trace their roots back to that program in the 90s and early 2000s, where the idea of direct access was born. So talk about the leadership who was there at that time and how that got started.
Yes, so we have a very large residency program, and so we have residents working in all of our areas, and we had a group of residents primarily working in the Psych Emergency Center and on the 10th floor back in the day, and as a result of their experience there, they decided that they liked psychiatric emergency medicine and took it to the next level from what we offered with our Psych ED and started their programs in Arizona. And I actually went out and toured their programs in Arizona to get ideas because I knew we were going to eventually build a psych emergency center. And so they were wonderful hosts, amazing work that they do, and so proud of the work that they provide for their community.
Yeah. So people like Dr. Chris Carson, Dr. Robert Williamson,
Yes.
Dr. Margie Balfour,
Yes.
all originally brought out to Phoenix in around 2005 by the then Regional Behavioral Health Authority to consult on what was being done in Texas.
Yes.
And we've had direct access facilities across the Maricopa County and then throughout Arizona going back to that time, but really coming from that pioneering work. Now, in the Crisis Jam, we are bringing you live and on location crisis units. We call them crisis receiving from the welcoming, direct access sort of nature of them. We don't actually bring you inpatient programs. Psychiatric inpatient's a vital component of the full continuum. You have a large 100-bed psychiatric inpatient. It's
We
not
do.
a part of this direct building, but it is connected
Correct.
by hall or whatever over to that pavilion. This is a crisis unit. And in particular, 23-hour temporary observation
Yes.
treatment. What do you call it?
We call it 23-hour OBS. We call it the Psychiatric Emergency Center. And the side that we're walking into is the main entrance, and this is what we call the voluntary side. So anyone in Tarrant County, North Texas, can come in this door and sign in and be seen by a board-certified psychiatrist, a social worker, and a nurse, and receive treatment and care.
And this is the voluntary. We'll see the involuntary. So like we've seen in Salt Lake City and in Columbus, Ohio, everyone is served out of this facility. If you want to call it, I mean, I don't know if it's the right term, but the Emergency Department of Mental Health and Substance Use Crisis, the EMTALA-like kind of an approach.
Yeah.
Anyone, anytime. And you've been modeling that here for many, many years, but now with the capacity and the learnings and the experience that you've plowed into this new, beautiful, amazing facility. So let's see it.
Let's do it.
Take us inside, Zelia.
All right.
Hey, Zelia, thanks so much for opening our doors. I don't think I mentioned that I was at the NASBIT conference and there was this architectural book with one of the sponsors showing these spectacular facilities. And it was Columbus, and it was Salt Lake, and then I didn't know about this
JPS,
program. And
yes.
you let us in, although we're going to, be patient with us. This program opened in September.
Yes, September 17th.
So Zelia and her team have gone to great lengths that we can see this facility despite it serving people today. So be patient with us if we have to pause. We've got a system in place.
We do.
But life happens as we go through. So,
yes,
here we
but
go.
it's behavioral health. You're flexible.
It's flexible, that's right.
So this is our front entrance, and I want to introduce you to Casey. He's one of our assistant nurse managers here, and I'm going to let Casey tell you about what happens right here.
So Casey, tell us about the front door, these metal detectors, the glass, the room, and how the flow works.
So we're in the front voluntary entrance right now where you'll be greeted by our unit clerk and behavioral health security officer. They're going to ask that you temporarily remove your belongings and place it in the spank teller system. Then you'll proceed through the metal detectors where you'll go into the front lobby. The unit clerk will complete your registration, and you'll wait in the lobby a short time for our triage team to come get you, and then they'll take you back to triage.
Yeah. So as I've gone through this facility, it's welcoming. There's a lot of dignity and respect and trauma-informed kind of components. And I think you miss some of the security elements of this that are built in. Now, obviously, you see the metal detectors. They're not intrusive, but you see them. But Justin, if you can come in and show folks the glass. So the thickness is about an inch or more. Tell us about why you have that glass like that.
So it is bulletproof walls from the floor to the ceiling. It's a horseshoe effect. That way, just in case, we do work in the psychiatric emergency setting. It's 2025 now, so it's just to protect staff safety and patient safety as well.
Yeah, so that's just embedded into the DNA of the facility.
Correct.
Great. Thank you so much.
Thank you.
Okay, we'll keep going, Zelia.
Great.
And, Zelia, we're gonna
walk right in.
Let's walk right in.
So you're walking in to our adult lobby. So where Casey was standing is where we separate child and adolescent. They have an entirely separate waiting area, and then we have adults over here. And so with that,
Let's go and sit down.
yes, let's sit down. I'll let you sit there. I'm going to give you that.
Good morning.
Good morning. So if you could introduce yourself for our Crisis Jam community.
Absolutely. I'm Dr. Nikisha Oliphant. I'm the chair for the Department of Psychiatry and Behavioral Health.
So, Celia, I want you in this shot. Can you come over here and sit? And I'm going to, you lead the medical physician, nurse practitioner
Correct.
leadership.
Yes.
And Celia, I imagine that the interface between operations, clinical, social services, and medical is important.
Absolutely.
What do you see as the key factor in your physician leadership in a program like this, and how you train and support and equip them?
Excellent question. Definitely the dyad partnership is absolutely paramount in the success of what we do. As the chair for the Department of Psychiatry, we not only employ physicians, but also nurse practitioners, physician's assistants. We provide training for the future residents, so we have 40 of those a year. We have child and adolescent psychiatrists and psychologists, and we also have medical students that come through. So part of the partnership is not only delivering that high quality care that is evidence-based, and we're listening with compassion, we prescribe, we diagnose based on what is the top quality care, what is the standard of care, right. And we listen for each individual patient, so it's personalized. And part of that requires that operational partnership as well, because we have to get them through the door. And we have to partner together, not only with prescribing, but also with the nurses providing some of the education. Our social workers are involved with what's that next step of care. Right. Do they need to go our inpatient unit, or do we connect them with outpatient services? So it really does take the full team to provide the services here.
So I wonder how you think about your physician staff and risk management. So one of the things I noted, Zelia, you shared, is that fully about 70% of the people in your 23-hour program, and audience, they're only there for less than a dozen hours on average.
Yes.
They're going back to the community. Mm-hmm. Maybe 1 in 3 is going into inpatient.
Correct.
So that's a level of clinical medical confidence. Yes. That I think sometimes you don't see even in an emergency department or psychiatric inpatient.
Yes.
Where does that come from?
So with our training programs, before any of our providers are operating independently, we have a high level of supervision. We set that standard of care and excellence for diagnosing and prescribing to make sure that it's safe. Right. First of all, we have to make sure what we're doing is safe, even in an emergent situation where time is of the essence. Right. So there's close supervision, training and education before individuals are seen by a physician, physician assistant, or nurse practitioner. We staff 24/7. There's always a physician 24/7, in addition to our advanced practice providers and our trainees. So there's never anyone that's practicing alone. If there's a question, if there's a really complex or complicated case, there's someone right next to you or in the very next pod that's able to answer that question or provide some context, because they've been doing this for years. Maintaining our staff, our providers, is also very important to us, because now there's that historical knowledge. Sometimes patients come back more than once, and having known them from a prior experience of saying, we know what worked last time, or we remember where their strengths are, or where their opportunities are, so we're able to engage them in that short amount of time, because we bring also that level of knowledge and familiarity with our patient and our community.
Terrific. Thank you so much for your
Absolutely.
leadership and the work you're doing.
Thank you.
As we go, Zelia, on to the Resource Center, there's a number of questions, especially in the YouTube live stream, but also in the Zoom, around safety. And we'll get more to those a little bit around the safety of the staff. And there's some other questions about the portal, which we'll try to come back to some of that as we go.
Okay.
So I'll give Zelia that. And Zelia, the Resource Center.
Thank you, Dr. Oliphant.
Thank you so much.
Yes,
Dr.
this
Oliphant,
next stop.
the Resource Center,
Yes.
was this part of the 10th floor, or is this a new addition?
This is a new addition. So when we designed our facility, our providers And we're involved, Dr. Oliphant, we had tons of meetings, but also our direct care providers were involved, as well as our patient and family advisory council. And one of the things that they really wanted was just a space for a family resource center and a private space to have conversations with families in the waiting area, and also to be able to connect with available community resources. So this is a result of that.
Perfect.
Come on in. Hey, Chris.
Chris, thank you so much. Chris Culver.
Yes.
Yes.
Nice to meet you.
First volunteer here at the Psychiatric Emergency Center. And Chris, Jammers, for Chris, this work is deeply personal. Your wife, Leslie, died of suicide in 2021. Leslie herself was a social worker, respected community leader, a partner of yours, Zelia, in expanding loss teams for this area. So this room in particular, Chris, the Resource Center, reflects a legacy of care and connection, of not being alone in the hardest moments. Thank you so much for being willing to spend some time with us and share this space with us.
Yes, and continuing her legacy, that's why I'm here. And then the foundation and Zelia also to continue her legacy is to name this the Leslie D. Culver Family Resource Center.
Yeah. And what do you hope people have, either information or support, when they're part of this, and how does it work?
Well, depending on what's going on with the family member, there's a lot of resources here that I can show them and talk to them about, but most of the time they just like to either be by themselves, or I'm here just to chat with them and make them feel good about that this is a great organization, a great place for their loved one.
Yeah. And how does that work? You're coordinating with the staff, you're canvassing the waiting room. What's the
Most of the time,
process?
yes, I'm there waiting for a family member to come in. I also help if any of the staff needs something that is not clinical,
Right.
that I can help them when needed too. But most of the time, it's for the family members.
So Zelia, even as we were talking with Dr. Oliphant about the risk and the work,
Yes.
this team aspect of it and all of the people in it really make it a different kind of a thing than traditional, whether it's an outpatient relationship. That is in an interdisciplinary team, but not as active as what we're seeing that Chris is now a
Yes.
part of as well.
Oh, yes, Chris is definitely part of our team, but it is a true everybody hands on deck teamwork environment here because of the different areas of progression a patient may go through. Then it will be important that we've got appropriate handoffs and communications, and that safety along every route. I would like to say, because I've got a lot of my leadership manning the areas to make sure we can get through this since we're open, but I do want to give a big shout out to Shannon Sims. She's our Executive Director of Nursing.
Right.
And also Chris Cook. He is the Director of our Psych Emergency Center.
Chris is trying to stay out of the camera.
Yes,
today.
he is. He is camera shy, and so is Shannon, but that's okay.
Yeah.
Their work is evident by the culture that you experience here.
Thank you, Chris. Thank you, Shannon. And Chris, you've been amazing helping broker this morning.
Yes.
So thank you, Chris.
Thank you, David.
Look, in our prior two live and on locations, we spent a lot of time talking about 23-hour observation.
Yes.
And also the co-located short-term crisis beds, if you want to call it, or short-term inpatient. But the idea of urgent care, we didn't spend that much time. They did have the concepts, but not open and moving. Let's go to the FastTrack.
Let's do it.
All right.
Okay.
Thank you for everything you do for us, Chris.
Bye-bye.
So we'll come out back through the main lobby here, and we'll head to FastTrack.
And that urgent care, that was also a part of the 10th floor?
Yes.
You were telling me that ironically, it was actually, so far, you've just been open a matter of weeks. So far, it was faster up there than the amazing speed we're going to see you've already attained here.
Correct. Yeah, and it's taken the staff to understand, traffic flow patterns and clinical flow patterns since we've moved in here, because it's very different than what we've had.
Right. So
And-
we're gonna
yeah.
be meeting Ben George here.
Yes, we are.
So it says FastTrack right there
Yes, it is.
on the door.
So when a patient's brought in from the lobby voluntarily, they come into the FastTrack here. Hey, Ben.
And we've cleared the space, but normally
Yes.
this would be bustling.
Yes, normally this would be full. And then we have 5 fast-tracked exam rooms. And I want to introduce you guys to Ben George.
Oh, hi.
He's,
You guys want to take it into one of the exam rooms?
Oh, why not? Yeah, let's do that.
And you,
Yeah. Oh, yeah.
And Zelia, why don't you sit right
Okay.
there? So Ben, tell us about, would you call this urgent care for mental health crisis?
Yeah, I think that's a good description of it. It's kind of that first line into the hospital. And if you're in any sort of mental health crisis or having any sort of issues, this is the first place you can come.
And maybe we're going to get into both the clinical program components of this, and we're going to talk a little bit about the business aspect. I'd like to queue up Dr. Deb Pinels if she has a comment or question here in a couple of minutes. So Dr. Pinels will come back to you. So Ben, tell us a little bit about what someone would receive in their interaction here.
So they would come in and they typically have a psychiatric complaint or concern that they would like addressed. So they'll come in, they'll see a nurse and be triaged, and then they'll get an evaluation from either a physician or an APP.
Right.
And once that interview is complete, they receive some sort of follow-up planning. So we typically are making sure that they have some sort of game plan for what they're going to do when they leave here for whatever their complaint was. So sometimes that's an outpatient psychiatry appointment. Sometimes that's a visit with a counselor. A lot of our patients are needing social work intervention, where social work will come and meet with them, give them housing options, placement options, other resources in the community. So we really try to make sure that our care here is all encompassing and is not just a quick visit, one and done, see you later.
Prescription voucher?
Yeah, absolutely. Yeah, we have vouchers for medications for patients who need that. We help with transportation. We a lot of times are able to arrange a taxi, an Uber, a bus pass, that kind of thing.
So in terms of flow, Ben, does everyone triage here first and then some people go on to 23-hour, or are you making that determination up front?
Well, the patients who come in voluntarily are triaged here in the front. And then depending on what we end up doing with those patients, some patients leave immediately.
Right.
And they're discharged with either a prescription or a follow-up plan. And then there are other patients that do require a little bit higher level of care. And so those patients will move from this triage area into our back area. They'll typically be here for a longer period of time.
That makes sense. So, Zelia, I think our Crisis Jam audience will be a little flabbergasted by the volume.
Yes.
Most people are here in 90 minutes or less. I mean,
Correct.
they're here for a total
Yes.
of 90 minutes or less, and they're getting the services you talked about, and they're either then some percentage are going into higher levels or they're going back to the community. Talk about the volume that you're seeing on a daily basis.
So on a daily basis, we see about 65 patients a day, but we've also seen 75 a day as well. Since we've opened the doors, our volume has gone up for September, October, and December. We were projected or budgeted to have around 22,000 visits for this fiscal year.
For the program in total,
Yes.
almost everyone would come through here.
Yes, and but if we continue our current pace, we're projected to have close to 25,000 visits this fiscal year, which is great because those are 25,000 patients we're able to help, and they're getting the right care in the right place at the right time, and so that's why we're here.
So just to reflect, those in another community, those 25,000 might be involved with law enforcement. They might be in a hospital emergency department for hours or even days before they are beginning to talk about the possibility of the kind of services and support you're talking about.
Correct.
Whereas here, they're all in and out with their needs met in 90 minutes or less, or for some percentage they're going on. So Zelia, talk a little bit about that kind of flow and volume is not something specialty mental health has historically been able to swallow. I think, I think a little bit about the airport and, going to the lines and the getting through security. And then you have innovations like TSA PreCheck, innovations like Clear, which are designed for flow. And you were telling me about one of the things you did was hire from
Yes.
your hospital's ED, because
Yes.
one of your team told me we know flow,
Yes.
we know throughput.
Yes.
Talk about that, Zelia.
Sure. So we definitely improved throughput on the inpatient side with a discharge lounge, but we still needed to optimize what we're able to do in our psych emergency center. So Chris Cook, who we just mentioned, I'm very happy to say I was able to steal from our medical emergency room. He was the manager over our medical ER. And then he came as our director, and then Edith Isidro, Edith Isidro is our manager, and she was Chris's assistant manager in the medical ER. Yeah. And so she is our manager here. And because of that, they've been able to really optimize our flow as well as data, showing providers data on times and time to see a patient and things like that.
Terrific. Deb Pinels, Dr. Deb Pinels, would you like to jump in?
Yeah, first of all, thanks for inviting me to speak. A fabulous program. I'm so impressed. I love the wall with the design and all the natural scenery and making it more like a home-like environment. I think that's really, really important. It sounds like your flow is fantastic. I'm wondering if stealing those staff caused any rift with your emergency department where you need some good relationships, or whether having them know that system makes those relationships still strong.
Well, so it did cause a little immediate rift, but we already had a good relationship with the medical ER, and obviously it's stronger now, but we've made it even stronger with EMS admissions to our psych ER versus medical ED.
Yeah. And Dr. Piners made a great point. So a lot of times these facilities have been run by specialty independent organizations, but here, JPS, you are both the hospital and this crisis provider under that same roof.
Correct.
Dr. Piners, you also mentioned this. This is, Zelia, tell us about how you went about this particular picture.
So obviously, and I'm going to move that a little bit. Thank you, Ben. We had to make sure it was psych safe, and so this is actually, we had a 3D AI computer, and we put in the scene we wanted to, and this is actually was painted into the wall.
It's printed on the wall.
So there's no edge, no nothing for a patient to harm themselves. Yeah. And so I had never seen anything like that before, but now we have.
Yeah, great. Okay, so there is a question, Zelia, and thank you so much, Ben. Great work.
Thanks, Ben.
Appreciate this. There is a question in the chat about capacity, but people are trying to sneak ahead in the program, Zelia. That's coming up in an over-under trivia.
Yes,
so be thinking on that. Well, we'll give you this. The FastTrack has 8 rooms.
This FastTrack has 5 rooms. We have 3 on the child adolescent side, and then on the involuntary side, we have 7.
Yeah. So these are the rooms for assessment and engagement.
Yes.
Obviously, when you're talking capacity, I think you're talking about the recliners that are in the units, and we're going to get to that, because that's what makes all this flow.
Yes.
Because normally, without those, you don't have a resource to meet people's needs in the moment. And you have not only that, but we talked earlier about 1 in 3 are going to need more, and you do have inpatient here as well as other programs throughout the city. So this brings us, Zelia, to our first trivia question.
Do you want to do it in here or in the hall?
Let's do it as we walk.
Okay, let's do it.
Our time is about right.
All right.
So our first trivia question is, this is our third live and on location event we've done.
Okay.
Columbus, Salt Lake are fantastic facilities.
Yes, they're
beautiful. But this one has something they don't.
Okay.
Is it A, child and adolescent care? Is it B, embedded law enforcement? Is it C, co-located inpatient beds? Thank you, person in my ear. Or D, police and EMS drop-off? Yes. So our audience, you see that poll, be thinking about this now, Zelia, as they think it through.
Do you want me to say now or wait?
No, we're going to tease a little bit. Okay. They're going to be thinking about that law enforcement, first responder waiting.
Yes.
They actually saw that in Salt Lake City, and they saw that in Columbus, because that's what really differentiates the next generation direct access kinds of a program. So it's not that. And there are some other programs, but what differentiates this facility that those other facilities didn't have?
So we have our police for Tarrant County. We have 26 police agencies. 70 police agencies in Tarrant County alone.
So is Danny trying to stay out of camera?
Yes, he is.
Well, you could just at least say hi.
Yeah, this is Danny Webb. Danny is our assistant police chief. We have our own police department here at JPS.
How you doing?
So the law enforcement component we're going to see right now, but what this facility has that we didn't see in the prior two programs was a child and adolescent unit. And we're going to get to that, so we'll hold on that one for now.
Sure.
Danny, thank you.
Yeah, you're welcome. I'll turn it over to Fort Worth
Let's
Psychiatry.
get in here.
Great.
We're going to come back here.
Yes.
So this is the...
So when police or EMS come in, they will get a brief intake, and they'll come in here, and then we have two triage rooms to do a short triage to make sure, vital signs and things like that, because that's very important. And then once they're stabilized, then they will be able to go to the further assessment area.
Right, great. So let's walk out into the space.
Okay.
This is the actual portal.
Yes.
And I haven't met you. Hi, what's your name? Kiana. So yesterday it was Carolyn. So
yes.
Kiana, yesterday there were 11 drop-offs when I asked Carolyn. There had been 10 police cars and 1 EMS during that. How many of you had today? So a little lighter today with 3. So, but in a year, how many law enforcement and EMS drop-offs are you going to have? What percentage of your total 22,000?
Probably 50%.
About 50.
Just so far this year, we've had almost 13,000 police drop-offs. And we, for the first time ever, opened up EMS direct drop-offs to all of the EMS systems in North Texas. And that was October the 23rd, and thus far we've had 170 come in.
So that's taking hold right out of the gate. So we've been told, and we've said ourselves, that there are these cultural and payment reimbursement barriers, and you're breaking through those.
Yeah, we want the business. We wouldn't have built this if we didn't want it. We want to take care of people.
Oh my goodness, look at all these.
Look at this.
We've got EMS and police cars.
Yes, we do. Fort Worth's finest.
And oh my goodness, I had some notes, but that's blown up because we've got a dozen people out here.
Yes.
Law enforcement and EMS. Where do we start, Zelia?
Well, first off, let me just say thank you for your service and everything you all do. They are amazing. They have a very strong mental health program within the Fort Worth PD in order to take care of folks while they're doing their patrols. But they have been very supportive. We get a majority of our police drop-offs from the Fort Worth PD. And then Curtis is here with EMS. We started with Fort Worth EMS first, and they have been strong. I sat down with their medical director and I said, we want your patients. You're sending them to medical ERs that don't have psych and don't know what to do. We do. Bring them here.
Yeah.
They'll get the right treatment and the right care in the right place.
Terrific. So we've got a couple of comments in the chat, as you might imagine. They want to interview the dog.
Yes.
So we've done this. This is our 3rd facility around the country that has this kind of support. It's the first time we've had a police officer dog show up. But Dr. Richard McKeon, if we can put you on notice to maybe queue up a comment or a question. But let's hear first from EMS, and then let's hear from law enforcement about how this process works for you, how it's helpful, and what would happen if this didn't exist.
This has been a great partnership with JPS. It gives us access to a facility that's able to serve our patients in a much more concise fashion. We are right in the center of town.
Yeah.
We're able to
this is right off the freeway. It's a
right
mile
off of the freeway, right in the middle of the service
downtown,
area.
we didn't say it, but downtown is just right there.
Yes, sir.
2 miles.
Yeah, that's about right.
Yeah.
And close to the rest of the medical district here.
Why does Zelia get to pet?
Because I'm a dog person.
So, look, we've been told at times EMS staff themselves, they'll say things like regulatory payment challenges, but then even when those are broken through. They talk about the risk and their comfort with taking someone to a medical ER. So tell us how you've blown through those challenges here.
Well, we've got a forward-thinking medical director that was able to partner with John Peter Smith Hospital to understand that these folks don't need to be delayed going through an emergency medical process. They need to get to the care for the situation that they're working through. And this allows us to get them to that care quicker, reduces recidivism, and that they are not coming back through the process to get the care that they need. And I think it's more respectful to the patients in that we're not sort of funneling them through the whole system.
Love
we
it.
get them directly to care.
Love it. So we're going to go to law. Thank you so much.
Yes, sir.
We're going to go to law enforcement now. But before we do that, let's take a look just at the. So for those of you who, Dr. Richard McKeon, you visited Tucson and seen Dr. Margie Balfour and the Connections Health Solutions team. This feels very reminiscent of the capacity and the Sally Port that's available in Tucson. Zelia?
Yes.
Tucson was one of the facilities
Yes.
you visited.
Yes.
Again, you guys pioneered
Margie
this
was
in the first
awesome.
place.
Yes.
But Chris and Robert and Margie took that to Phoenix. They then went second generation, I
Yep.
guess third generation in Tucson. And
Yep.
where else did you visit as you're thinking about how this all should
Just
flow?
there.
Just there.
Just there.
Yeah.
Yep. And then, talking with our law enforcement partners and EMS, the challenges that they experienced going to where we were on the 10th floor, and then looking at safety for the patient and our first responder partners. It really, this is why it's here.
So the 10th floor, a little bit convoluted, right? The person was often in handcuffs, walking past the morgue, under the basement, through the elevator.
Yeah.
Law enforcement shaking their heads. So tell us about how this one works. How do
Yeah.
you get
Who
in?
wants the
How the
microphone
process
first?
flows.
Oh, no.
I'll take it. I don't mind.
Okay.
So yeah, that's exactly right. When we used to go in through the back, parking lot there, we had to go under this flight of stairs, through all these double doors, and past the morgue, like you said. It was not an inviting experience, right? And when you have someone that's already in crisis, they're already having a bad day, arguably one of the worst days of their life, we're walking them through not an inviting place, right? So being able to come here, it's a much quicker process. We're able to get in and out quicker with everybody, and it's a brighter facility, so to speak.
Yeah. Normally, even though it was challenging over there, in most communities of the country, you're going to a hospital ED.
Mm-hmm.
What challenges does that create for you, not just individual?
A lot of challenges, right? So if we have to take somebody to the emergency department, we're potentially stuck there with them, depending on what's going on with that. Oftentimes, people don't necessarily need to really be in the emergency room. That's an unnecessary step in the process that slows down everything. It slows down the entire process. And
most of them don't need it.
They don't need it.
Yeah. Thank you all so much. This is spectacular. We appreciate your work, and Zelia, this is terrific to have these.
This is our CIT team
Yeah.
from Fort Worth, and they rock.
Yeah.
Y'all are incredible, and I want to kidnap your dog.
Well, before we go, Dr. Richard McKeon, quick comment or question for Zelia or the team.
Okay, can you hear me now?
Yes, you're with us,
Well,
Richard.
Great. What wonderful work. I'm so grateful for the work that you are all doing. It is an extraordinarily impressive effort. I do have one question. I love the urgent care concept. Of course, it's not a new concept in medicine, but it is a new in mental health, and it's a huge advance in terms of being able to provide access. What we see sometimes, in mental health centers and so forth, is that you may get an initial evaluation, but then sometimes there's a long wait, for example, to get into outpatient mental health services. And so people require follow-up rather than just a referral. How do you all deal with that challenge?
So we have.
Let's walk. Zelia,
Okay.
as we go. Thank
Sorry,
y'all.
Thank you.
Appreciate you.
We have 8 outpatient clinics, and we do partial hospitalization, IOP, as well as med management and counseling. We also offer walk-in clinics for emergence in the outpatient clinics. And so last fiscal year, we had 55,000 outpatient visits in our 8 clinics, and we are literally able to get them in the next day after they leave the psych emergency center to outpatient treatment.
That's really impressive. Thank you so much, Richard. So we're going to do a quick 1-minute primer of the legal process. April, tell us about that.
All right, I'd be happy to. So the majority of our patients present to us involuntarily, and so they're being brought in by police, as you heard about, either on a detention warrant or a magistrate warrant. And that paperwork and those warrants allow us to provide an evaluation to the patient to figure out if they meet criteria for inpatient care. If they do, my team steps in. I have a wonderful, skilled, and compassionate group of social workers and LPCs, and they complete the Order of Protective Custody submission paperwork. This paperwork is several pages long. It is very tedious. They do a really amazing job for the volume of applications that they're completing. Once they complete that paperwork, they're sending it over to our mighty team of 3 legal coordinators who are then reviewing that paperwork for completeness and correctness, and then that team gets it over to our Tarrant County Probate Court. And the probate court, those judges are the ones who then review the applications, and they make the determination on those applications being granted or denied. And those legal status, that paperwork allows us to make sure we're treating the patient legally while they're here. A lot of our patients may not always agree that they need care, but we know that they do, and this process allows us to care for them and help them get better to return to the community.
Great, thank you so much. Is that available Monday through Friday, 7 days a week?
So we have social services staff that are here 7 days a week. The court is open Monday through Friday, and so this process with formal submissions is business days, but because of the volume, it's work that's being done around the clock.
Terrific, thank you so much. So we're going to keep strolling.
And I just have to give a plug for our social workers and LPCs, because we could not function and get people where they need to be in a timely manner without all the great work that they do.
Yeah, that's terrific. Zelia, there is a question in the chat about the integration of peer supports. How do you guys at JPS inform and engage peers in this process?
Great question. So we employ peer support specialists as full-time employees here. We have, I think, 14, and so we have them in our inpatient units, and they also make rounds in the area that we're getting ready to go to now, which is our adult unit.
Okay, so Zelia, we've been doing a lot, but now this is it. This is the actual crisis.
This is it, yes. But just real quick on our peer support specialists, they are vital. They do groups, they do aftercare follow-up, they do everything for us. And we've got both mental health peer support specialists and substance use support specialists.
Yeah. So as we're going into the adult unit, the question was asked earlier about capacity, and we'll do our over-under now of what is the capacity. And Zelia, the capacity from your prior 10th floor unit was what?
34.
34 beds.
Yeah,
so,
chairs.
Laura Evans, I'm going to call you out if I could. Laura, what do you think the capacity of this program is? It's obviously more than 34. Where do you think we're at in terms of, and now we're not talking about the urgent care part, we're just talking about the crisis facility part, which is those recliners. How many recliners? Just as a context, the program in Columbus that we looked at has 60 capability of recliners. So what does this program have? Laura Evans is going to give us a number, and our audience is going to pick over or under.
Okay.
Laura, what do you think?
All right, well, you're putting me on the spot. I'm trying to count behind you all to see it and maybe multiply. But if you said Columbus has 60, I'm going to guess that JPS has 75.
75 is a really good guess. So, audience, Richard McKeon is the king of crisis trivia, or he was. Laura's trying to unseat him. Do you want to go over or under? Karen, how's our audience seeing the capacity? Again, I'll give you another clue. You're looking at just one of the 2 units because right now JPS is live and active and they've moved everybody into 1 unit for an hour. And so you're looking at half. I'll go one more. You're only looking at the adult unit. And there's a flex unit. So Laura cut it really close. The actual number is 78?
No, 140.
140. Well, you're talking about capability that you've got, Zelia,
yes,
to expand.
for back here.
So this footprint.
Just right here on the first floor, 140.
Holy smoke. Holy smoke.
And above us, there are 2 of these spaces side by side, like that are down here on the first floor, that are shelled out so that we can, for future growth, because Tarrant County is one of the fastest growing counties in the country.
So for those of you jammers who are in the tech on this, the throughput formula is your capacity up against your average length of stay, up against your occupancy multiplied by the days of the year. Now, if people were here for 7 days or 10 days, you'd be serving a fraction of that.
Right.
But because they're here for what, Zelia?
So if you include our OBS hours and length of stay period for patients back here, it's on average 10 hours length of stay.
Yeah. So people are in and out.
Yes.
So let's talk a little bit with our medical lead.
Yes, our medical director.
And find out about what happens in that 12 hours and how that works. Dr. Schneider.
Yes, Dr. Schneider is our Psychiatric Emergency Center medical director. Hey, Dr. Schneider. Good to see you. You too. I'm going to give you the microphone now.
And Dr. Schneider, we're running a bit behind, if you can imagine that. So have you been watching on YouTube?
I have been watching a little bit.
Tell us what happens in that 12 hours and why the service is so vital.
So we have this beautiful observation unit you see here where patients will see a provider. We have a room here open as an example, where we can interview patients, or if they need to decompress or just have a timeout, we can come in here and talk, do the interview, and determine what the next level of care is. For the patients who stay here on observation, we're going to prescribe them the appropriate medications. We have activity therapy, recreational therapy that can go on in the room behind us, and patients get 3 hot meals a day. Social workers will come meet with them and find out if there's things that they need from that aspect of mental health treatment as well.
Yeah.
And then how quick your teams are in doing your evaluation too is a big part of the throughput.
Yeah, we're seeing patients pretty quickly, typically within 2 hours or less on first contact with the patient.
So in particular, you're talking about the door-to-doc time. How quickly a provider is seeing them once they're in here. There's other social services and activity and other supports, but getting to that physician has to happen quickly if you're going to turn around someone in 12 hours.
That's what Dr. Schneider set for his team, 2 hours or less.
And for that 1 in 3 approximately who might need a psychiatric inpatient program, how does that work? And do many of them go next door to the pavilion?
Correct. So those patients will stay here until we find an appropriate inpatient bed for them. We will continue assessing them daily to see if their needs changed or if we need to make modifications on treatment plans.
Yeah, terrific. Okay, thank you so much. So Zelia.
Thank you, Dr. Schneider. Dr. Schneider helped develop all this. I just got to say, he was an amazing partner.
Yeah. So in addition to the clinical medical program, the thing that was just strikingly impressive is the analytics and the management of data in real time. And that brings us to
Edith Isidro. She is the medical emergency room nurse manager that I stole for over here, and I'm so grateful we did. But Edith, why don't you talk about data and how that drives what you do?
And Edith, while you do that, we're going to bring up on the screen, if we were in the nurse's station and we were looking up at that top left screen, we would see the Power BI analytics.
Absolutely.
What is that?
Yeah, so we use several tools to help monitor our patient throughput. One of them is our Power BI dashboard. It displays real-time metrics of our unit, so it captures our total volume and census, our FastTrack patients, our throughput in general for our discharges, admissions. We're also able to see a look into the medical ED side, because we want to be good partners with a medical ED and get the patients to the right setting. So we're able to see their volume and the number of patients waiting to come over to our unit as well. So those are daily metrics that we look at. We also have a daily snapshot that we print out every day. So it's a look back at how we did the prior day. So
we're going to bring that up on the screen as well. That's 8-day rolling look.
8-day look back. So we're
at
able
some
to
key
see
metrics.
Yes. So for example, yesterday we saw 59 arrivals. On Monday we saw 60 arrivals. So we're able to look back and see how many patients are arriving to our department, and as well as how efficiently we've got them through the unit. So we look our provider arrival to provider time, our triage times, our discharge times, and we're able to capture that visit in under 11 hours.
If you look, you guys are on Epic, which that's the medical software platform that rules the world, and it gives you all of this incredible capability. Heidi Warrington, you're giving all kinds of great comments in the chat. Is there a comment you'd like to make? And while we're doing that, Zelia, she's a natural.
She is.
Terrific.
Edith, I'm telling you, I was doing executive rounds over in the medical ED, and it was the best executive round I ever had.
Yeah. This is amazing work. Heidi, do you have a comment or a question?
Yeah, first, this is one of the most amazing facilities I've seen in the country thus far, so strong work, bravo, and I just love the integrated, so I'm a nurse executive by background, and I love the integration of how you, from the very beginning, you mentioned providing nurse education, or nurses providing education, you have this amazing milieu, and then the integration of acute care principles into the crisis system is the secret sauce. And these logistics and nursing dashboards just blew my mind. And so I just wanted to, and then also this data-driven, informed data-driven throughput. I think that we all can use this as an example throughout the country with the freestanding crisis systems, and wanted to acknowledge you all. So very impressive, strong work.
Terrific. Thank you so much.
And as much kudos as they give to Chris and myself, I do want to give a strong acknowledgement and a shout out to the entire team that takes care of our patients, from our providers to our nursing team, our behavioral health techs, and the social services that we have are incredible. So what we do, we're able to do through their help and support.
Great work. Great stuff. Okay.
Thank you, Edith.
Zelia, shockingly, we're behind schedule.
Okay, we can walk fast.
11 minutes for a flex unit.
Yes.
A child and adolescent unit.
Just a second here.
And a
I don't want
security
you to think we're
keypad.
keeping you, David.
You might need to. Okay. Here we go.
All right, we can walk and talk. What Edith left out with regards to the data, so they have weekly meetings with Dr. Schneider to review the data with all of his providers.
So this is not something just gets reviewed. It's used in real time and reflected on continuously.
Yes. Okay, this is our flex unit.
What does that mean, Zelia?
Okay, this unit, we are able to, for patients that are geriatric that are
Have
brought
special
here,
needs.
special
IDD.
needs, IDD, autism, those type of things.
Maybe you have a young child who doesn't fit in the milieu at the moment.
Yes.
To get some one-to-one over here.
Yes, and the length of stay may be longer over here, and so we do have rooms with beds so that we're able to make sure that they're comfortable while we're waiting on a transition and placement.
The 3D printed art in the room. Again, it's minimal, but that adds a lot, right?
It does, and you can see. I mean, it's just totally flat. There's no edge.
So constantly trying to balance safety and dignity, respect,
humanity,
and humanity.
Because mental illness is health.
So, Zelia, introduce us to Susan.
My favorite partner. I'm going to introduce you all to Susan Garnett. She is the CEO of My Health, My Resources, which is our local mental health authority here in Tarrant County. Susan, I'm going to give you that.
Thanks, Zelia. So you guys also operate 988 in addition to being the MHMRA, and tell folks what that is.
That's right. We are one of 4 community mental health centers across Texas who answer calls for the 254 counties of Texas. Right. We're a pretty massive state, and so it's the strategy we use. And through 988, we hear from people who sometimes need a little support, sometimes need some resources, sometimes need a lot of help. We're incredibly fortunate here in Tarrant County to have the kind of partnership we have with JPS and to have this incredible resource for emergency services as well as for inpatient services. Right. Our responsibilities to the state are for primarily community-based services. We also help to fund the inpatient services here at JPS.
Terrific. Well, thanks so much for the work you do. How is 988 going?
So 988 is a great resource. We've operated a 24/7 call line for many years here in Tarrant County, but 988 provides new additional kind of resources for folks. So we always encourage people to reach out to 988 if you're not quite sure where to go or who to talk to or what you're even asking for. We encourage you to call 988. We have highly trained staff who are going to be there to answer your questions, to provide you with support. Maybe you need to go deeper into the mental health or substance use disorder system, and maybe you just need support tonight. That's okay.
Thank you so much. Thank you for the work you do. Okay, Zelia, we'll keep going.
Okay.
And Zelia, are we up to the Tech of the Year?
Yes, we are.
Tell us about Jordan.
Okay, Jordan is one of our lead behavioral health techs, and we were discussing this yesterday evening with David. And so we use Observe Smart to do rounds on our patients for line of sights, one-to-ones, and Q15. And I'm going to let Jordan.
So, Zelia, before you do that, tell our group why Q15 is so important in this environment.
Well, it's for safety. It's for safety of the patient and the other patients. Our patients, come in and they're wanting to hurt themselves or others sometimes. And so it's a protective factor for the patient, and it just creates a safe environment.
Yeah. So we're talking about worst day of someone's year, so the worst day of someone's
Correct.
life. Sometimes people are agitated. Sometimes they're aggressive.
Yes.
Yesterday we heard a few code whites as we were preparing.
Yep.
And so you do everything you can to support, but sometimes, so Q15, making sure you check in on people.
Yes.
It's hard without this. How does this work?
Okay, so this is.
I'll hold this one.
Oh, okay, thank you. This is our the tablets we use. We use Observe Smart as the program. This is all not real patients, so I can show y'all. We use the Beacon, and that's a bracelet we put on each patient when they come in and intake. It's a Bluetooth signal, so it'll pair to this tablet here. You can kind of see how that patient is lit up. That means that's the Beacon. So I'm able to click it and say what they are doing at that moment, where they are at and what they are doing, whether that may be bathroom, attending to hygiene, or room 1, agitated, and just different behaviors. And that way the doctors and the nursing staff are able to see what the patients are doing every 15 minutes for their safety without having to be right there doing it.
Yeah, so that is such a support not only for you and your documentation, but for the guests.
Oh, absolutely.
To make sure that the system is prompting you.
Yes, absolutely.
And look, we're on the Flex unit, which isn't being used right now, so that means the bottom board doesn't have patient information on it.
Correct.
And we can see that dashboard we were talking about earlier at the top. We do have a very important comment from the YouTube live stream.
Okay.
They say, hey, that's my mom.
I have met her kids, and they're adorable. So, hey.
Say hi to your...
Hi, kids.
They love
we're going
you
this way
too.
now.
They love
Jordan,
you
thank
too, Jordan.
So much.
Thank you.
That Q15 component,
Yeah.
if you don't run a facility, you don't realize how hard that is without this kind of
Well, and the
support.
beauty of it is it automatically documents that
Right.
into our Epic electronic health
Goes
record.
straight into Epic.
Yes, and so there's no more paper for rounding.
So, Byron! Byron, pleasure. Byron Williams with the Players Association was here, president of the Dallas
NFL
alumni and wide receiver, played for the New York Giants, among others. The last text I got from my father before he passed away, long live the Giants.
Absolutely.
It was 2012. I guess they just won the...
Well, I was there I was there with Bill Parcells, and I'll tell you, Bill Parcells took it to a whole different level.
Yeah.
He changed the mindset of all the players.
So thank you for being here, both Tim and Byron. And look, this is the child and adolescent unit.
Yes.
And both the facilities we saw earlier, Breakthrough programs in Salt Lake City, Breakthrough in Columbus, this one integrates not just adolescents, but youth.
Yes.
And we've got Matthew here from the Jordan Elizabeth Harris Foundation, from the Hope Squad, to speak to why this kind of a service is so important. These men that they start out at Ball State, but before that they're in high school, they're in middle school, and they've got issues, and those issues happen when?
Well, really any time at all. I mean, that's the hardest part, is you just cannot schedule a crisis. And for so many of these students, they're facing an issue at 9 o'clock at night on maybe a Saturday night. They don't have a school counselor they can call. They don't have a psychiatrist that they can get a hold of, and yet they can come right here to JPS. They can get in right away, see somebody 24/7 who's able to then give them an assessment and let the parent know this is something really, really serious, or hey, this can wait till Monday. And that's the kind of thing that our parents are desperate for within this community.
Right. And tell us about what your foundation is.
So the Jordan Elizabeth Harris Foundation was founded in 2014 in response to the death by suicide of our namesake. And we work with all age groups throughout this area to provide mental health services and suicide prevention services. We serve 160 schools covering about 140,000 kids right here in North Texas. And what we found is that in order to really be successful, it's not just about being able to recognize these warning signs, that's really important, but you need a place like JPS to send kids to. And so what we've seen is that since we've kind of gotten to the point where kids now have the training to be able to say, hey, there's a peer that is an issue, suicides have dropped 80% within this community. But that can only happen because these amazing third-party providers are stepping up to offer that immediate service, because otherwise parents might be waiting 4, 6, or 9 weeks to get in to see something at the worst moment of their lives. And so we're just so grateful for JPS and everything that they provide for this community.
Terrific. We only have about a minute left, but Byron, can we just get a quick comment from you for why you think this kind of a service is important?
No doubt. We have almost a couple of thousand former players here in Dallas, and we're always trying to find resources and things and ways to solve them. Not only them as a family, but their kids as well. And I know JPS is doing great things. I went to UTA, and I'm real familiar with the dynamics of the Metroplex. But when Eric Hipper called me and told me about what you guys are doing and how we can make a difference, that really sit well with me, and I was so happy and delighted to meet you and the organization. And I know JPS is one of the best facilities in the country, so I'm just excited to be a part of this.
Tim, Byron, thank you so much.
You're welcome.
Thank you.
Matthew, thank you. And we're going to make a quick comment, and then we've got about a minute left, Zelia. So, Zelia, as we're walking, I wonder what, we really didn't have time to get into the clinical program differentiation for what makes the child and adolescent unit work that's different from the adult unit.
So we have child adolescent social workers and our nurses and techs that work on those units are specially trained in child adolescent also. We're able to separate based on male and female and then age. If we have someone younger than 13, they're going to be a 1-to-1 for safety. But we have, it's just a different milieu. We've got games, we've got electronics, and different things like that, so that we're able to set up a lot of family involvement, even though it's back here, because they're part of the solution, hopefully.
The economic impact of this, the clinical, medical, congratulations.
Thank you.
On your legacy of work, but then this brand new, amazing facility.
It wouldn't
JPS
be,
is, wow.
Just very proud of our CEO and our executive team and our board of managers for having the vision and the commitment for this to happen.
Yeah, thank you.
Thank you.
So we're gonna walk outside.
Okay.
Zelia, thank you.
Thank you.
Zelia's gonna let us out here. I'm gonna give this to Kristen.
Well, I said I'm gonna let us out.
Well,
you know what? We may be blocked.
Sometimes these doors.
Okay. We may go out a different way.
Let's try one more time.
Okay, got it.
Okay, third time.
Third time's the charm.
There we go. Thank you, Zelia.
Thank you. Thank you.
So we're just going to take a couple of minutes to round out our review here. Kristen Ellis, wow.
Yeah, I know.
Spectacular new standard that JPS is setting. And I can't believe I came here and didn't know that this whole movement related to crisis facility care started right there on the 10th floor. Chris Carson had told me that in years past, but I just didn't have any context to put it together. The one thing I wanted to just chat with you briefly on is at RI, we operate some facilities like this, and we haven't used the plexiglass fishbowl kinds of areas.
Yeah, and we saw that
but
in Columbus.
I came away with a different sort of perspective. Theirs are really unique, and they're out there engaging on the unit. Talk about what your reflection on that was.
Yeah, I mean, yesterday when we were here for the prep, we actually got to see the units live. Unfortunately, you all, for the privacy of our guests, actually, fortunately, we had moved them all to the other units, so you can actually see the space. But while we were here, we got to see a lot of engagement on the floor. The plexiglass fishbowls, we tend to shy away from them, but because we think it hinders engagement. However, here they don't use them to hinder engagement at all. They're literally back there just to fill out some paperwork, but staff are actively on the floor working with the people that are here in need, and I don't know, it actually works really well here. It's intentional.
The trauma-informed nature of it, and then the power of what the medical side brings to this. You can see that DNA of the Epic, the Power BI, the analytics, and the view of scale and flow, while never sacrificing safety, dignity, respect, or the true outcomes, clinical medical recovery outcomes you're trying to achieve. I'm blown away.
Me too.
Frankly.
Me too.
We're going to have to reflect it and sort of absorb all of this. But wow, what an incredible 3 facilities we visited this year.
I know, and such different facilities, but all serving the same communities with the same needs.
So thanks to JPS, thanks to Zelia Ball and her entire team. They were spectacular, amazing work. And thanks to our sponsors this year.
with AHP, Behavioral Health Link. Really, really grateful for your continued support so we can keep things like this live and on location and our weekly jam going.
And we'll take a couple of weeks off, and then Kristen, we're back on January 7th with a debate.
Debate number 10. It's about medical clearance. Am I correct?
Yep.
Yeah.
It's Jonathan Thomas and Kevin Curtis.
It's actually the 2 gentlemen from our Salt Lake location and in Columbus.
And Monica Johnson is going to moderate. So have a wonderful holiday, everyone. Have a great new year. And we'll see you in the Crisis Jam as we continue to highlight these amazing works across the country. But kudos, JPS. Wow. Thank you so much.